So there shouldn't be any weight on the arm. Yes.
I got a question. If you know they needed this done, could you talk to them? Would you have them do this before they got undressed?
Mm-hmm. Yeah. Yeah, you could even do it with the clothes on.
Okay. Yeah, I mean, yeah, because it's not gonna happen.
Just sit up naked.
And the more you can get the arm elevated, the shorter it'll get too. In fact, go on that side too. In general, start with compressing the whole deltoid. Okay. Jumped ahead of myself. So start by compressing the whole deltoid all the way from origin to insertion. Okay. Is sore, Denise?
Yeah.
So working from the origin to the insertion. Anywhere it's tight, just kind of make note of that. Okay. So if their humerus is internally rotated, which one do you think they'll be complaining about? Anterior or posterior? Posterior. Which one do you think is going to be tight?
The interior.
Anterior. Okay. So they're gonna be like, oh, just work there. You're like, okay, I will, but I need to do all this first. Okay, when you get down here, like I'm basically just kind of tracing the deltoid all the way down to its attachment, to its insertion. Okay, so you can, sometimes it'll be real tender when you get down there. There's also the deltoid bursitis. Okay, there's a bursitis right there for the deltoid. The deltoid goes right over this bursa sac and then attaches to the deltoid tuberosity. Okay, so if you feel a bump and you keep going over and it doesn't go away, that's probably the bursa sac. Okay, so don't keep rubbing it, try to get it out.
Can you pop it?
It'd be hard to pop it. But it'll get really inflamed before you pop it. So it'll start hurting like crazy, and then it'll still be hurting the next time you come in. Okay. So just be aware of that. Then we're going to go back to the anterior delt. We're going to go with the compressions. And the better I can get it into a shortened position, the easier it's going to work. The easier it'll be to work the muscle. So even if I could have her incorporate a little bit of internal rotation like that, that'll help. Okay. And that's going to help me. You can see that I'm really getting underneath that muscle, underneath the anterior delt like that, because I want to try to get as much compression on the muscle as possible. Sore too much? It's okay. So it's the same thing, just working all the way down the deltoid tuberosity. Okay. We want to be pretty thorough when we're treating the deltoid. After we've done that, then we're going to go back and we're going to treat compression with opposition. Okay? Being real specific to the anterior deltoid. And if you find a spot that is tender, that's sore, you spend some more time on it. Okay? Tell me when you feel a sore spot. Right there? Okay. So I'll hold static compression there. Tell me when it goes away. Still feel it? It's better?
But my arm twitches.
Hmm?
My arm twitches.
Your arm twitches? But it's less sore there. So about 10 to 12 seconds on that. If it doesn't go away, then move on. Okay, don't keep hanging out there. If it goes away, like that loosened up, right? Yeah. Okay. So after I've worked anterior delt, then I'm going to go to middle delt. Okay. So she's going to turn a little bit more sideways, more perpendicular. Then I'm going to go start, same thing, start up at the origin, compress, doing compression on middle delt. And it's the same process, okay? Just compress all the way down to the deltoid tuberosity. Any place that's tender or sore, you can compress it a little bit more. After you've done compressions all the way down to deltoid tuberosity, you'll come back up and do compression with opposition. Okay. So there's compression all the way down to the tuberosity. And back up, compression with opposition. You guys sore? Mm-hmm. Yeah. Sometimes if the deltoid is tight, okay, or there's trigger points, it can simulate like a, bursitis in the shoulder, okay? Even like a rotator cuff tear, things like that. If supraspinatus is having problems, it can refer to deltoid, right? So, and we always start with the deltoid because it does the most movements out of any other muscle on the shoulder. Okay? And it's also the most superficial muscle on the shoulder. So if this muscle doesn't get treated and you treat all the other muscles, what happens is, their pain might still come back. Right? So then after we've done that, then I'm going to have her rotate away from her arm. Like that, and that'll shorten up the posterior delt. If they can't do this movement, okay, you just, work it as best as you can. Alright? So again, starting up near the origin again, starting with compressions, going all the way down the deltoid, pretty much the same thing, right? Alright? Just on a different part of the muscle bone. Yeah, sore, Denise?
A little bit.
Is that?
A little, not too bad though.
Little? So whenever I'll demonstrate this before we get on the table. When you guys go back and you work with your partners, I want you guys to check range of motion. Okay? Check range of motion in the shoulder and see which shoulder is tightest, which one has the problem, and then work that shoulder. Okay? And you can go through that compression up to 3 times on one muscle. Okay? And then go back through and then do the compression with opposition. You can even do it where you do compression all across the muscle for each one of the fibers, then go back and do compression with opposition on each one of the fibers. Okay? It's sore there. Mm-hmm. Yeah. So again, a sore spot, I'm going to hold a compression there. And she should feel it loosen up or get less sore. How's it feel now? Better? And then I can also compress a little bit more. Still feel it? No? I'm going to do a little bit more. Anything there? Okay, so pretty much after that one, it was all gone. Okay. Sore there?
A little bit.
That's pretty sore there, huh? Okay. So, a little bit of lotion. Going to start at the deltoid tuberosity and work our way up to where it attaches at the origin. Okay. And I probably could have spent some more time on that anterior delt. There's still some tender spots there. Huh? And just working from insertion to origin. And then come back to here and do the same thing. Now working the middle delt. Okay, and then working posterior delt. Okay. The other thing is if you're working with a volleyball player, tennis player, okay, this posterior delt could get real tight, especially when they're serving. Whenever they're serving, if they do a lot of serving, you have somebody comes in and they're a tennis player, volleyball player, okay, and they're like they've been constantly going back with the arm. All that is, I mean, you think about that movement, external rotation with extension, and then they're having to go forward. And you're doing that repetitively over and over again. That's going to get real tight, real developed. Okay.
I can work on Serena Williams after these classes.
Yeah. Okay, good. The very last thing that we'll do is we're going to work right at the origin, right at the clavicle, okay? And we're going to just basically work right along where the origin is, okay? Just pin and glide, kind of like what we did on the knee, okay? Pin and stretch. Any of that sore? Or I'm flipping over right there. Okay, so you want to make sure that you're not right on top of the bone, but you're like right up on the front of it, okay? You could even do just kind of a compress, cross friction right there. And then the same thing right there. So that's the acromion process. And I'm just going to keep working around right along that origin. Sore there? More in the front, huh? Okay, so if that was sore in the front, I would go back there and isolate that some more and work on it. All right?